Welcome back, everyone. Dry skin affects a significant portion of our population, and as the largest organ in the body, the skin performs many functions that are important. And the doctor is in this morning to discuss psoriasis and dry skin. Good morning, Dr. VJ.
Good morning.
Now, two different things we're talking about here. What are the differences?
Well, dry skin, everybody can get at some point in their lives. It's just people being in an environment that's a little bit too dry, not appropriately moisturizing their skin, maybe being in the swimming pool too long or too much sunlight. But everybody can experience that in certain areas to a greater or lesser extent. Psoriasis, on the other hand, affects about 2.5% of the people in America.
Wow.
It's a fairly specific condition where the body's immune system itself is attacking the skin. So whereas just about anybody can get patches of dry skin, psoriasis is something that only affects a few of us.
How does that affect someone? What are some of the side effects, or what do people experience when they have psoriasis?
Well, dry skin and psoriasis are both very bothersome to people. Depending on the amount of skin that's affected, it can affect the appearance of the skin, it can get infected, and it can actually cause people enough angst as to where they're not comfortable being in social situations, and some might actually avoid them altogether. That's really the major effect. But there are a few people who have psoriasis that can affect other parts of the body in addition to the skin, such as the joints, where they can get arthritis and other things that can actually be debilitating to them.
Okay.
But most of the time it's a skin appearance, social discomfort. They may not get this response from others around them that most of us would.
Well, let's talk about, for people who have dry skin from time to time, what are some of the treatments for that?
Well, the best thing is to avoid situations that exacerbate them. We all have certain things that may make us more likely to get significant areas of dry skin, such as being in the pool for too long, being out on the beach for too long. So what you need to do is you need to avoid extremes of exposure, and of course use moisturizer. That's important for all of us. It's not really for the really young or the older people. It's important to keep the skin moisturized, because that's one thing that allows the skin, as the largest organ, to function optimally.
What about psoriasis? Can that be prevented?
It can't be prevented. As everything else, there's the genetic component, and then there's the environmental component. So far, there's nothing we can do to fix the genetic component, although it looks like there are treatments that are coming out that are tailored to that. But the environmental component is something we can certainly affect. One is being able to use moisturizers. And just as in people with dry skin, psoriasis also can be exacerbated by certain things. Most people have some triggers, either a specific environmental irritant, say an allergen, or some source of stress, or even sometimes an infection such as strep throat.
Interesting.
So being on top of it, getting these things treated, avoiding the extremes of exposure, all these things will prevent psoriasis from getting significantly worse. You can't prevent it, but you can certainly prevent it from getting bad.
Okay. Some good advice. Thank you very much, Dr. VJ. And remember, Dr. VJ is here Sunday to answer all of your medical questions. So if you have a topic you would like us to discuss in the future, shoot us an email at news@KRRR.